One of the reasons why I like President Trump is because he uproots everything and changes the dynamics. But when it comes to healthcare, it seems to be a very complicated system. A good portion of Hispanics, we all voted for Trump. So it's kind of like a betrayal in a way.
Nearly 5 million people who live in Florida get their health care through the marketplace or Obamacare plans more than any other state. But the cost of these plans are set to skyrocket in 2026 as federal subsidies that made them more affordable will expire. Are you guys on the Affordable Care Act, marketplace healthcare? Have you checked whether your premiums are going up next year? It's open enrollment period.
I think they are. I think they're going to triple or quadruple, something like that.
29, el seguro se me puede incrementar a $380, $400.
It's going to be $684, and that's going to be a $7,500 deductible.
Yeah.
If it goes up that much, we're going to have to cancel. Can't afford it. No way.
Entonces uno dice, ¿cómo pagaste un seguro tan alto, verdad? Con los sueldos tan bajos que uno tiene aquí. ¿Cómo haces?
The premium is going to be $1,261 every month. At the end of the day, people are going to die.
In the last election, every single Florida county moved right, including Democratic-leaning or Hispanic majority counties like Miami.
I voted for DeSantis.
I love you, Papi Trump. I love you.
But while some Trump supporters point fingers at the Democrats,
They did it to blame the Republican Party.
So many people are about to lose their health care, and so many millions of Americans. As a matter of fact, every single American around the United States is going to be impacted by the effects of this big, beautiful bill. Let's just be honest. And we're seeing a lot of impacts fall into place right now as we speak, because a lot of people are in open enrollment right now. Well, actually, I think it's about to close pretty soon, and they're seeing their healthcare costs double, even triple in some cases across the board. And it sucks to see that so many people are still standing behind a lot of these policies. Hence why we were in the government shutdown for as long as we were, guys, because now a lot of these policies are about to take an effect next year in 2026. And now you're going to see prices even skyrocket even more than what they already are. It's ridiculous. I don't know. And people, even MAGA, like MAGA all over, they're losing their health care as we speak. And now they are furious. But at the same time, you also have the other side where they are still supporting a lot of these different things. So I don't know. At the end of the day, you got to pick your decisions, and maybe this outweighs everything else within your life to where you could still continue to support a lot of these different things. I just don't agree with it, and I don't think it's right, and I don't think it's making America great, as so they say.
Because then it was like, oh, he's the one at fault. No, he's not.
others feel abandoned by the president.
In South Florida, we don't feel like seen, heard, or valued in any way, shape, or form.
Catalina, who goes by Kat, is a freelance community mental health consultant. She gets her health insurance through the Affordable Care Act.
Health insurance, it's something that you don't think about when you're younger because you're just healthy, right? You can just kind of like bounce back.
Kat didn't give much thought to health insurance until a sudden medical emergency changed everything.
First, I had really bad lower back pain. They told me that I had issues with my kidneys. It was a total of 3 weeks of being hospitalized. I guess while I was in the hospital, my hands started swelling.
After her kidney issues began in 2022, Kat's health made full-time work nearly impossible.
I did end up having to get on the marketplace in 2023 because the kidney issues and also with my ADHD. I take the highest level of Vyvanse, 70 milligrams.
I need to take it so I can get out of bed, basically. I need these medications to function.
If you can't afford health insurance next year, what happens to your medication?
Well, particularly the Vyvanse is very expensive. Without health insurance, it's $300 to $400.
And this is the problem, guys. A lot of people didn't sit back and do their research. A lot of people just sat back and voted based on identity, right? A lot of people didn't look at things like the resources that they were given. A lot of people didn't look at, the policies that he was talking about implementing. Guys, think about it. Trump, during the rallies, he was always dogging on things like Obamacare, well, which is now called the Affordable Care Act. He was always talking about get rid of it and making his own system, which he was also working on during his first term, but it never came through, guys. Like, these are things that, most people, they thought that it wasn't going to be this way. However, at the same time, I don't know how. It was basically an open notebook test. And then shout out to her. I mean, I get it. She probably voted the wrong way, but I'm very curious to see how she's able to get around this, because those health issues seem very, very serious. And I'm not wishing any kind of harm on her whatsoever, because I can understand how hard it is. I mean, I'm not finna sit here and point the finger and oh, you voted this and you voted this and you deserve this. That's not what I'm doing whatsoever. My point is, we shouldn't even be in this situation, in this position in the first place.
We have a COVID-era stimulus package that was aimed at easing financial burdens caused by the pandemic. They've saved enrollees an average of about $1,200 a year on their health insurance premiums, but they're set to expire at the end of 2025. Democrats in Congress tried to make the subsidies permanent, triggering what became the longest government shutdown in U.S. history. In the end, 7 Democrats and 1 independent senator broke ranks and voted with Republicans to advance the funding deal, which included a promise of a mid-December vote on extending the subsidies. However, no agreement has yet been reached in the House under Speaker Mike Johnson. Without the subsidies, millions of people like Kat will face a new monthly expense on top of an already rising cost of living.
Yep, and the cost of living is already through the roof, and they're gonna go through, what's going on at the grocery store as well, and just regular cost of living, different things, right? And I'm gonna link the video in the description below, because it's a very long video. I think it's 8 to 10 minutes long, right? But even as we look at just everyday cost of goods, everyday groceries, everyday, gas prices, living expenses, rent prices, utility prices. When we talk about different things across the board like that, you add on along, healthcare costs, as well as, everyday, you add all those different things together and you have a recipe for disaster. And so many Americans are lining up, trying to figure out how they're going to make it through this situation, because they are seeing a huge, guys, think about your paychecks every single week. Let's just take an example. You make $5,000 a month, right? Let's say you pay $5,000 a month after taxes. If you have a family of, let's just say 4 people, right? A family of 4, and you have to pay for healthcare insurance or whatever, right? And that healthcare insurance is $1,500, $1,800, $2,000. Can you imagine how much of that budget is going to take up just for healthcare alone? That's ridiculous, guys. And this is where so many Americans are drawing the line, and they are furious, because you already got $2,000 worth of rent costs, let alone if your house is even more expensive. You already got, cost of goods and cost of growth. You got all of these different things, and you put it all together, and families are absolutely giving up, and they're struggling. It sucks to see, and sucks to see families like this all over Florida who, I don't know, they were absolutely, I guess, misled or even uninformed to the extent. They put it on identity versus, actual policies of what is going to benefit themselves, their family, and the people around them the most.